Hi, my name is Dr. Goldstein, and if you're watching this video, it means we have surgery coming up in the next couple days. So this is kind of a summary video that I put together to highlight some preoperative instructions to help make your day go as smooth as possible. If you still have questions, obviously we're going to have an appointment a few days before surgery to go over those questions, but this video should hit the highlights and help you with most things. Take notes if you want, but most of this information is also uploaded in your portal. So just look through that at your leisure to get everything that we talk about here. Okay, so let's talk about a few weeks before surgery. It's important to stop taking certain medications before surgery. These medications include ibuprofen and other aspirin products, and all herbal supplements, as these can affect bleeding during and after surgery. It's also important to stop other supplements that can affect blood clotting, like fish oil and high-dose B vitamins. If you take other supplements that aren't on this list, just let me know. We can go over them on an individual basis. It's also important if you take GLP-1s like Ozempic, Mounjaro, or Zepbound. It's important to stop these medications at least 2 weeks prior to surgery, as they can really affect complications with anesthesia. Okay, another little aside, if you develop any illness like a cold or fever or cough or urinary tract symptoms prior to surgery, please let us know. This surgery, although very important and something you've waited for and are excited about, is still considered elective, and we don't want to put you at risk if you have a developing infection or illness that could put you at higher risk. So please let us know. We can always get you rescheduled if we need to. Okay, so it's now about 5 to 7 days prior to surgery. Let's continue our pre-op instructions. You can continue using acetaminophen, also called Tylenol, for pain if needed, but it's really important at this point that we stop all additional supplements, including iron. Multivitamins, for the most part, and probiotics are okay and safe to continue. Now, the day before surgery, it's really important if you take a medication called metformin or any medication that contains metformin that you stop this the day before surgery. Any other medications that you take on a daily basis, like for high blood pressure, for example, they're typically okay to take unless you're told otherwise. Additionally, the hospital will call you a day or two before surgery to go over all your medications, and will explain the ones to stop and the ones to continue. So typically I'm going to prescribe a medication called scopolamine. It's a patch that goes behind your ear. You're going to place that the night before surgery. This medication can greatly help with post-op nausea. It often causes dry mouth and dilated pupils, so don't be alarmed if you wake up seeing or experiencing that. Additionally, some people get a little bit dizzy or uneven with this medication, so if you do feel like that, you can take it off at any time. There's enough medication in every patch for 3 days, so you can keep it on, but if you feel like you're doing okay once you get home, feel free to take it off. It's important to pick up a soap called HipaCleanse prior to your surgery and wash your entire body and your hair the night before surgery. The antibacterial soap HipaCleanse is usually best used for this. We'll have you use it, especially all over the abdomen, and wash out the belly button the night before surgery. If your surgery is later in the afternoon or late morning the next day, it would be preferred to have you do this again in the morning of surgery. It's important the day of surgery, after you shower, do not apply any lotion, oils, or perfumes to your skin. Remove all your jewelry, piercings, and nail polish. Now, if you have piercings that are unable to be removed, just let the preoperative nurses know at the day of surgery, and we will figure out ways to get around that, often including taping these piercings. Now, it's very uncommon, but the reason why we have people remove piercings is we use electrocautery during surgery, and this is electrical current that, even though you are plated safely for efficient and safe use, sometimes the current can go to these piercings and cause local burning. It's uncommon, and we will have you have to sign a consent form if there are piercings that can't be removed, but just wanted you to know why we go through that practice. Okay. So it's also important to not drink alcohol or smoke for 24 hours prior to surgery. And we usually tell you to stop eating solid foods the night before, about midnight the night before surgery. Technically, we want you to stop eating solid foods 6 hours prior to surgery, but it's easier just to remember to stop after midnight the night before. Now, clear liquids, that's different. We really want you to consume some clear liquids even the morning of surgery, even up to the time you arrive at the hospital, which should be about 2 hours prior to your procedure start time. Drinking clear liquids such as water, Gatorade, Propel, or other liquid carbohydrate drinks that are clear is safe and advisable and will help with your recovery. Lastly, I want to talk about things that you should have at home after surgery. I will go over prescriptions as well. However, what I want you to have at home, I want you to have a stool softener like Colace. This is important so you don't get constipated after surgery. In addition, a laxative like Miralax or Docalax can be helpful as well, especially if you end up taking a narcotic. You can also get a medication over the counter called Gas-X, and this can be helpful for bloating or abdominal distension post-surgery. Let's talk about your prescriptions. Typically, we use a multimodal pain pathway, also called an enhanced recovery pain pathway. This includes 4 prescriptions. Well, four medications actually. One is acetaminophen or Tylenol. You can get this over the counter, but sometimes we'll try to prescribe it for you. And the dose that you're going to be taking is 1,000 milligrams every 6 hours. And that's 500 extra strength over the counter capsules. In addition, we'll send in a prescription for ibuprofen, also called Motrin, 600 milligrams, and another medication called gabapentin. It's also called Neurontin, and this will be 100 milligrams. And this will be taken every 8 hours. The last medication we'll prescribe is called oxycodone, and this is morphine. Nothing to be scared of. We only give you 6 tablets of this medication. The tablets are scored, meaning that you can break them in half in equal parts and even just use 2.5 or a half tab at a time if necessary. And that's only for breakthrough pain. So the key here with the multimodal pain pathway is that you maintain some of these medications in an around-the-clock or scheduled fashion, meaning you take them around the clock at scheduled times, no matter if your pain is low, medium, or high. The point of this is to keep your pain from oscillating greatly. There's going to be periods of less pain and more pain, but we want those oscillations to be as minimal as possible. So if we take the Tylenol, 1,000 milligrams, followed 3 hours later by Motrin, 600 milligrams, and continue that every 3 hours, Tylenol, Motrin, for the first 3-4 days, you're going to do great. On top of that, the gabapentin or Neurontin is also scheduled every 8 hours. And we've provided you a logbook in your handouts on the portal to keep track of when you're taking what, so you stay on top of things. And this does mean even waking up at night to take a medication to prevent, again, big spikes in pain. We know that these spikes will still happen, but hopefully less. And if they do, and you need something to break the cycle, that's what the oxycodone is for. This you can take, like I said, a half or a whole every 6 hours. Hopefully, most people don't need many or much of it at all. But if you do, that's okay. Everyone's threshold is different. It's very common to get constipated even with 1 dose of this medication. So make sure you start the Miralax every day and the Colace for stool softening at the same time so you don't get constipated post-op. So the majority of our surgeries are laparoscopic using keyhole incisions. Typically, we try to restrict those incisions to 3-4 incisions, but sometimes with severe disease, we have to go as many as 5 incisions. These we all try to keep down below the level of the belly button if possible, depending on the pathology size that we're working on. All of these incisions are going to be closed under the skin with dissolvable suture and on the skin using a skin glue or adhesive tape called Steri-Strips. The belly button will be covered with a cotton ball and a Tegaderm, which is a clear bandage on top. All these bandages are waterproof and you can shower with them on the next day. The belly button bandage with the Tegaderm should be removed after 2 or 3 days to let the belly button breathe. You're also going to wake up with an abdominal binder, a big white Velcro binder that goes around your belly. This is not a medical necessity, but something that's comfortable for most patients post-surgery. It provides a little bit of pressure against the abdominal wall that's now been distended for a period of time during surgery and just gives you some added support and feels good. It also may be an indicator to young kids that you've had surgery, so they'll be less likely to jump up on you or kick you in the belly. So wear it as little or as much as you want, but again, there's no medical necessity. It just usually feels good and most patients like it. Now, it's common after laparoscopic surgery to experience a little bit of shoulder and neck pain from the gas that we use during surgery. We try to minimize this by using low pressure and not tipping you back too far, but inevitably, sometimes people get a little bit of this. It does go away after 2 or 3 days. Don't be alarmed by it. If it's absolutely terrible and you can't get comfortable, one of the things you can do is lay down and put a few pillows under your bottom, and this will prop your bottom up, and the gas will rise up to your pelvic area and away from your diaphragm and may give you some temporary relief. After surgery, I will review your case with the loved one or support person that brought you, as long as I have your permission. I will usually provide a booklet of photographs from your procedure and have that person record me talking about those photographs so that when you wake up from surgery, you can watch the video and see the photographs and know exactly what we did. I will always call you the day after surgery, and we will always have 2-week telemedicine appointments already scheduled to go over pathology and your recovery at that time. I'll be available 24/7 and will provide you with that phone number the day after surgery to be used for any urgent or emergent purposes. Otherwise, if you have any routine questions, just shoot me a portal message and I'm quite responsive using that. So the next several segments are going to be about post-operative instructions. So after surgery, I will always call you the day after surgery and check in, like I mentioned, and provide you a phone number for urgent and emergent phone calls. I will want to be notified immediately if you have a fever over 100.4, if you have severe or worsening pain, persistent nausea and vomiting, heavy vaginal bleeding, any foul-smelling vaginal discharge, any chest pain or shortness of breath, or difficulty urinating. It's important that for the first 2 weeks of recovery, you have reduced activity. Don't try to overdo it. Most of our surgeries will allow you a quick return to most activities of daily living, such as bathing and eating and walking and doing most of the things you need to do around the house. But anything more than that, you should just be leery of and listen to your body. If something hurts, don't do it. Your body's telling you it's not time. Usually after a typical laparoscopic surgery, we'll tell you to avoid swimming pools or baths for the first 2 to 4 weeks. In addition, we'll tell you to avoid intercourse for the first 1 to 2 weeks as well until you are feeling better. If you've had a hysterectomy, that changes. You have pelvic rest instructions for 8 weeks, nothing in the vagina or anus for 8 weeks. And this is very important to not disrupt the vaginal incision. For the first couple weeks after surgery, it's important not to lift more than about 15 pounds. I mean, obviously, if you have to once in a while, that's okay, but repetitive bending or lifting of that weight can be detrimental to your healing process. At the same time, avoiding strenuous activity is important, but we want you to go for walks if your pain allows you to. It's important to move to reduce the risk of infections in the lung or blood clots in the leg. In terms of showering, you can shower the day after surgery. Like I said, the Steri-Strips, glue, and Tegaderm are all waterproof. And just as a reminder, take the Tegaderm off your belly button after 2 or 3 days. Otherwise, it will smell terrible and can increase the risk of infection. You can drive as soon as you feel safe to do so. You can't be taking narcotics, so no oxycodone when you're driving. Make sure you just feel like you're safe enough to get in and out of the car, change lanes and such, and that your pain doesn't limit your activity or your ability to be safe in the car. And for everyone, that's different. Some people that might be a couple days. Some people that might be a week or more. Just don't overdo it. I think the one thing to really express about this type of surgery is that although it's minimally invasive, a lot has been done inside your body. So although you stand at the mirror and you see only a couple incisions on your tummy, your body's doing a lot of repair work on the inside. It's very common to be fatigued after this type of surgery. For example, you might go to the grocery store and think you're going to get everything done and realize after just a few short minutes that you're just too tired, and that's okay. Your body's using all this extra energy to heal on the inside. So just listen to your body. Your body is very intuitive and will tell you exactly what to do and what not to do. Um, I would say in terms of activity or exercise, more specifically, people always ask questions about this. For the first 2 weeks, I would avoid any strenuous exercise or anything more than just walking. After that, I would do anything that you can really do in a chair for the next couple weeks. So from about 2 to 4 weeks, anything that can be done in a chair, whether that's machine work, light weights, resistance bands, things like this, chair yoga, doesn't really engage too much core. And after 4 weeks, you can get back to doing most activities and exercise that you would. But I would start at a much reduced level and work your way back up. Now, if you've had a hysterectomy, that's a little bit different. We want you for the first 6 weeks to avoid any excessive heavy lifting, bending, or squatting more than 25 pounds, as this can disrupt the pelvic floor and the vaginal incision. So it's a little bit different if you've had a hysterectomy. As a reminder, the skin glue will usually peel away after about 10 to 14 days. Steri-strips about the same, and once they do, you can pull them off. You can use silicone gel or silicone scar tape on the incisions after 2 weeks post-op to help accelerate healing and reduce scarring. It's important to keep in mind that when you're washing for the first few weeks, you just let the soap and water rinse over the incisions. But after about 2 weeks, you can go ahead and wash those incisions more specifically with soap and water. Make sure for the first year after your surgery that if you're in the direct sunlight, you keep your incisions covered with Band-Aids or something like that to avoid excessive darkening pigmentation from the sunlight, as scars will darken more than the surrounding skin. Lastly, I just want to thank you for entrusting me with your surgical care. I'm deeply committed to seeing you through this and making sure you recover as efficiently and safely and effectively as possible. Please read through all of the information about enhancing your post-op recovery with certain nutrients and supplements to ensure the best healing possible. Again, if you have any questions, don't hesitate to reach out. I'll talk to you soon. Bye-bye.